Hey everyone, welcome back to the channel. My name is Aryan Malik. I'm currently a third year nursing student, and this is Study With Me series. Today is day 34, and we'll be continuing our discussion in the part 5 of maternal OB nursing. Today, we'll be talking about maternal adaptation during pregnancy. So, pregnancy is divided into three trimester: first trimester, second trimester, and third trimester. So, as healthcare providers, how do we know that a woman is pregnant? So, it can be divided into three types of signs. The first sign we are going to talk about is presumptive sign. So, these are what the woman experiences. I presume, I think I am pregnant. Everything I see or I experience along those lines. So, everything that is under presumptive can be explained by something else. Say, if the woman says, I am tired, maybe they are feeling fatigue. Could be because of other things. If they say, I have amenorrhea, meaning their periods have stopped, it can be due to stress, or maybe in the recent past they took birth control. If they say, I have nausea and vomiting, maybe they just have a flu or they ate something bad. If they say, I have urinary frequency, it could be because of urinary tract infections. They say, I have breast changes, maybe they started a new form of oral contraceptives and that could cause the breast changes. They say, I feel quickening means a butterfly sensation. It is usually felt by women who have become pregnant. It's as a first sign of woman by the fetus, but non-pregnant women also might say, I feel quickening, but it can be just because of the gas in the stomach. They say, I have skin hyperpigmentation. In other words, they have skin changes. It could just be because of the sunlight or new medication regimen that they started. So, all the signs that we talked about, these are subjective. They make the woman think that they are pregnant, not necessarily meaning that they are pregnant. The next type of signs are probable signs. These are observed by an examiner who can be a registered nurse, an obstetrician, or a nurse practitioner. These are concrete. 95% of the times it means that the woman is pregnant. So, for example, during an examination, the examiner observes changes in the pelvic region, pelvic organs. So they say they see Chadwick's sign, which is basically the bluish discoloration of cervix. So cervix become more vascular in pregnant women, and it is a reason why they might see the bluish discoloration. Next is the Godel's sign, which is basically the softening of cervix. It is good to have a soft cervix when a woman goes into labor, as the cervix has to open. So basically, that is helping the woman during the labor. And next is positive Hager's sign, which is basically softening of the lower uterus segment. That is, lower part of the uterus is not firm, it feels soft. The registered nurse might palpate the enlargement of the uterus, or they can also feel the uterus above the pubic bone, being a probable sign of a pregnancy. They also experience something called Braxton Hicks contractions. These are intermittent and basically tightening action of the uterus, but the thing to remember is they are not the same type of contractions that are experienced by a woman when they go into labor. So, a woman might say, I feel tightening on and off during my pregnancy. So, this is basically the uterus is practicing to go into labor, but it is not labor. The next assessment or probable sign is when the woman says, I feel bloatment. So it happens when during uh, GYN exam, a registered nurse pushes up the cervix and they feel it bounce up and bounce down. So basically, it is a rebounding effect. So a way to remember is when you think of bloatment, think of balloon. Like when you kind of hit it and it goes up and then comes down, it has like a similar rebound effect during pregnancy. So these probable signs are objective and uh, they are like 95 to 99% that you are pregnant. Also, one thing which I missed out was positive pregnancy test that is also included in probable test. Now let's talk about the third type of signs, which are positive signs, which means the woman is 100% pregnant. The examiner hears a fetal heartbeat. Uh, Fetal heartbeat is anywhere between 110 to 160 beats per minute, and it is very different from a human heartbeat. Like human heartbeat is like pupuk pupuk, and it's like whoosh whoosh whoosh. It's similar to that. And when you go into a clinicals, this is something you might hear. And one of the other positive sign is the fetal movement, which is felt by an experienced practitioner, someone who has been in the maternity setting for a while. They can, while palpating or while assessing the woman, they can feel like, okay, here's the fetus's head is here, and they can make similar observations which will be considered as a positive sign. And as a registered nurse, maybe you see an embryo fetus on an ultrasound, which is basically the visualization sign. So that was all the signs, and I hope you found this video helpful. Please stay tuned for more videos that will be coming out in the future. Thank you for watching.